Good day, welcome to our learning session, and our topic for today would focus on thyroid disorders. So when we talk about your thyroid gland is a butterfly-shaped gland located anterior your trachea. So thyroid gland is part of your endocrine system. So when we focus on your thyroid disorders, there are just two things or two disorders that we want to highlight. We have your hypothyroidism and your hyperthyroidism. So since the thyroid gland is regulating the basal metabolic rate, it is easy to remember that when you talk about hypothyroidism, we are just focusing on the hypometabolic state of the client. You need to say hypothyroidism, meaning there is a decreased metabolism. The client is manifesting decreased vital signs. The client may have fatigability. The client may present weakness. The client might have a weight gain. The client may have cold intolerance. So since the client is having fatigability because of decreased metabolism, the nursing diagnosis that is applicable to client with hypothyroidism would be activity intolerance. And the drug of choice for which would be your Synthroid. The generic for Synthroid would be your levothyroxine, and that is your thyroid hormone supplement to increase the production of thyroid hormones. If we're going to take a look at the other presentation in the hyperthyroidism, there would be increased metabolism. So in the underlying condition of the client with hyperthyroidism, we only have to take note of hypermetabolism, which can lead to increase in vital signs, weight loss because of diarrhea. The client may present insomnia. That is the client also may present increase in vital signs, which can lead to seizure. So the appropriate nursing diagnosis applicable for client with hyperthyroidism would be risk for injury. So the drug of choice for your client with hyperthyroidism would be your tapazole or your metimazole. That is to halt the production of thyroid hormones. So bear in mind, the other term for hyperthyroidism is Graves' disease. But the other term for hypothyroidism is myxedema. But if you found hypothyroidism in a child, it is called cretinism. So in an adult, it's called myxedema. But in hyperthyroidism, be it an adult or child, it's called Graves' disease. Okay, so let us have a question for this. Which of the following interventions is a priority for a client with hyperthyroidism? Letter A, increase the room temperature. Letter B, increase calories in the diet. Letter C, increase caffeine intake. Or letter D, administer laxative once a day. So, what did we say a while ago? Your client with hyperthyroidism is presenting hypermetabolic state. The client might present diaphoresis. So, the client is presenting heat intolerance. So, letter A, increasing the room temperature, cannot manage the symptom of the client. It can all the more increase the diaphoresis. Same as with your letter D option, administer laxative once a day, all the more can contribute to the underlying diarrhea and weight loss of the client. Also, remove letter C, increase caffeine intake because your client with hypermetabolic state is already presenting insomnia. So that will lead us to answer letter. You are correct. Letter B, increase calories in the diet because we want to increase the nutrition of the client to counteract the diarrhea and the weight loss of the client. I hope you enjoyed our video and please watch out for our next video. Please don't forget to subscribe. Thank you.